Hello everyone, this is Edith. Welcome to week 13. I took care of my patient last week. She's a 68-year-old Caucasian female. My nurse practitioner inherited her from a psychiatrist who retired about 2 years ago. When asked how the patient was doing that day, she said, I cannot ask for a better life. She said her medication are working well, her children and her whole family is doing well. So she had no complaint. Okay, a little background on my patient. She's the youngest of 2 children. She has an older brother. She reported her parents gave them a loving childhood. She is married. She has been married for 40 years. They have 3 children together. She said they are all close. 2 of her kids live out of states, but one lives in the same community with her. Patient is very involved in her church, and she's a retired nurse. Her husband has his own construction business. Okay, we'll go to the mental status exam. My patient looks younger than her age. She's well dressed, appropriately for the weather. When asked about her mood, she said, I feel great. Her affect is bright, congruent with her mood. She denies any depression, mania, hallucination, anxiety, or delusion. Her speech is intact with logical connections. She is alert ×3. She says she has good memory. She denies any suicidal thought or any thought to harm herself. She has good insight. She's been sleeping very well, she says. For eating, she says she's a very healthy eater. She eats a lot of vegetables and fruits. For exercise, she says she has been exercising 4 days a week, and 2 of those days she exercised with her husband. All right, now we'll go to the DMS-5 ISIS. ISIS-1 patient has major depressive disorder. I would defer as ISIS-2. ISIS-3 patient has no medical issue. ISIS-4, the psychosocial environmental factors, patient is doing well. She's happily married. She has been happily married for 40 years. She's close to her children. She's very active in her church and her community. She's a retired nurse. Her husband has his own business. So financially, they are doing good. For global, for ISIS-5, the global assessment functioning, I will give this patient 98. Okay, for patient home medication, she has been on Trintellix 5 milligram daily, lithium 450 milligram CR daily at night. For my differential diagnosis for the patient, it will be generalized anxiety. I did not observe anything in her about anxiety, but major depressive disorder goes hand in hand with anxiety. Okay, so what will be the plans for this patient? The plan will be, before I go to that, patient has been in remission for her depression. So she has been seeing my nurse practitioner now every 6 months. And her lithium lab is now every 6 months. She just got it done 2 weeks ago, she said, and it's in therapeutic level. So she no lab required until 6 months from now. Okay, for plan, we'll continue the lithium 450 milligram CR daily, the Trintellix 5 milligram daily, and like I said, no lab is required. She's doing good. She's in remission, and she's a very bubbly, happy lady, very positive. For my references, I will use American Psychiatric Nurses Association 2013, and then again Scholl's Prescriber's Guide 2021. Thank you, everyone. Bye-bye.